Good afternoon, everyone. My name is Max Mowitz. My pronouns are they and he, and I am the program director at One Iowa. And I am here to introduce you to Ashley Ezzio. Ashley works at the Iowa Department of Public Health as an outreach and education coordinator. Ashley, do you want to tell us a little bit more about yourself?
Sure. So like Max said, my name is Ashley Ezzio. My pronouns are she, her, and I work at the Iowa Department of Public Health. I'm an outreach and education coordinator for the Iowa Breast and Cervical Cancer Early Detection Program, and I'm super excited to be here.
Yeah. Oh, thank you so much for being here. We're bringing Ashley in today to talk a little bit more about breast and chest cancer screenings, and all that really good information, because this month is Breast and Chest Cancer Awareness Month. So we want to make sure that folks know how to get screened, know the risks, and know where to go when they need resources as it relates to breast and chest cancer. So we're really, really excited to have you all here today. And we're going to talk a little bit about, why this is so incredibly important. And we also want to be clear here that part of the reason that we're working with the Iowa Department of Public Health is because we know that LGBTQ people don't get screened regularly for cancers, including breast and chest cancer, right? So, and there's a lot of different reasons for that. A lot of LGBTQ people have had really negative experiences with healthcare providers that leads to them not wanting to get regularly screened. A lot of LGBTQ people don't know their own risk as well. And many LGBTQ people, especially trans and non-binary people, feel really, really uncomfortable with the way that screenings usually go, and often can feel fairly dysphoric about the process of screening. And if you're not familiar with what dysphoria is the state of heightened discomfort with one's own body as it relates to the sex that they were assigned at birth, right? So one thing that is really relevant when it comes to what we're talking about today is that when we're talking about breast and chest health and breast and chest cancers, if you are, for example, a transmasculine person or a trans man that has chest dysphoria, which means you feel really, really uncomfortable with your chest tissue, it might be really, really painful and difficult for you to go get a chest or breast cancer screening. So that's something to keep in mind as well. But we're going to get all into that, but I just wanted to make sure that you all know that we recognize that this is really vitally important when we talk about the LGBTQ community. We need to make sure that we're getting screened, and we need to make sure that we have the information that's necessary to get screened, and that's why we're here today. So I am sitting with an expert, obviously, so I'm going to ask Ashley a couple of different questions here, and I'm really, really excited to learn more. So my first question is, why is it so vital to get screened for breast/chest cancer this month, and how can people get screened?
Great question. And I love your intro. That was so important. So I'm so glad to have your expertise here too with us, just so we can spread the word. One of the most vital reasons to get screened for breast or chest cancer is really because it's the most common cancer for individuals who have this type of tissue. We see huge amounts of people. Over 250,000 cases of breast or chest cancer are diagnosed every year, and about 42,000 people will die from it. And it's so unfortunate because early detection can save people's lives. It's so important. It can catch it at its earliest stages when it's most easily treated. And we don't want people to not get screened due to some of those fears you mentioned. We looked at a couple articles just to kind of get an idea. And when we looked at an article from Everyday Health, and they found that 120 transgender patients, in comparison to their non-transgender peers, they were 70% less likely to get screened for breast or chest cancer. That's a huge statistic, and it's very concerning. So it's so important that people are getting screened, that they feel comfortable, that they have the knowledge and the access to make sure they can get diagnosed early when treatment is easiest. You talked a lot about this, but we really want to make sure people know that having an inclusive doctor, someone that you're comfortable with, someone you can ask questions about, can really make sure that breast or chest cancer is treated early. In combination with other risk factors like genetic testing or genetic mutations, aging, the density of breast or chest tissue, if an individual is taking hormones, or maybe they're not as physically active, consuming alcohol, using tobacco products, those can increase an individual's risk of developing cancer. And those risk factors are something we want assessed by healthcare professionals, and we want individuals having those conversations. That's why our program, the Care for Yourself program, is really excited to partner with One Iowa. We want to help make sure people have access to the proper cancer screenings, and that they can access that care at inclusive, trauma-informed healthcare professionals. And our program can help cover the cost of that. So regardless of health insurance, people can qualify based on age and income status. So if you'd like more information about that, you can always reach out to Max, who has the ability to get you in contact with the Care for Yourself program, or you can visit One Iowa's website under our work and healthcare access. There's a link to our website and our phone number. It's pretty easy. It's 1-866-339-7909. We're happy to answer any questions and see if you qualify.
Awesome. That is such useful information. You know, as you were speaking, one thing that really popped out to me, especially when I think about health outcomes, is, you know, you mentioned that there are risk factors that can impact folks' risk of developing cancer, including things like drinking alcohol and using tobacco products. And we know that in the LGBTQ community, there's a higher rate of consumption of both of those products. So it's interesting, all of the different ways that things can intersect to increase your risk of cancer. And I'm just so happy that we have this amazing and really important information from you all, because it's so vital to our community. So I am also very, very curious. You know, we all know that we're supposed to get screened, right? But why is it so important to get screened regularly? And how can this help your risk of breast and chest cancer?
So we have some really smart folks who have decided what regular screening should look like for cancer. So we usually like to highlight the United States Preventative Services Task Force, which is a really long name for a lot of doctors and disease experts who have done the research, done their homework, and what prevents cancer best. And their recommendations for individuals with breast and chest tissue is, if you fall between the ages of 50 to 74 years old and your average risk for cancer, you should be getting a mammogram every 2 years. Those that are 40 to 49, really it's a good time to have a conversation with your healthcare provider. We want to talk about, what does your family history look like? What kind of signs and symptoms may you be having? So that then you can decide when is the best time to start getting mammograms and the frequency of those. And I think within this topic here, it's really talking about the average risk I talked about. A lot of folks are like, what does average risk mean? And that's why having those appointments with your healthcare provider, whether it's going through a risk assessment, looking back at your family tree, asking questions if you don't have that information, it's a really good time to become self-aware. What's going on with your breast or chest tissue? Are there changes? What's normal? What's not normal? So having your expertise in your body and what's normal for you, combined with what your provider knows, can help you make the best decision about when to start getting screened and how often to get those screenings.
Absolutely. Well, I am curious. So, you know, if somebody's watching this video, they're like, dang, I really need to get screened. What is the next step in that process? How specifically can LGBTQ people in rural parts of the state get screened? Because I know here in Iowa, in Des Moines and Iowa City, places like that, it's a little bit easier to access screenings. What can you do if you're in rural parts of our state?
Absolutely. That's a great question, because living in those parts of the state present unique challenges, whether that's transportation, providers, all of those things. So the Care for Yourself program that is run by the Iowa Department of Public Health, we have expert program coordinators available to residents of all 99 counties. So no matter where you live in Iowa, you have someone you can contact who is an expert in your area about what providers offer these services. And then with the help of One Iowa, we can make sure that those providers are inclusive and are a safe space for individuals to access. These coordinators also have a lot of community resources and expertise. So if there are challenges like transportation or childcare or any kind of dependent care, we can help you find resources to make sure you can go to that screening and take care of all your other responsibilities. So we hope that that eliminates a lot of the barriers to care through those experts in the community.
Awesome.
So Max, you've asked me some questions.
I have.
Now, I would like to ask you a question so that individuals can really have a good sense of breast and chest cancer screening. What do you think? How can providers be more inclusive for the LGBTQ plus community and getting screened for this type of cancer?
Yeah, well, I mean, if there is a healthcare provider that's watching this video, you're already doing some really awesome work. Keep watching videos like this, keep learning. The first thing I recommend doing is taking it, like zooming yourself all the way out and seeing what kind of high level things you can be doing at your organization to be more LGBTQ inclusive. So my recommendation always is to schedule an LGBTQ 101 and healthcare best practices training with us. It's that I don't just say that because it's my favorite thing on earth to do, but truly the training takes you through everything you need to know about the LGBTQ community from the very, very basics all the way up until how to update your intake process, how to talk to patients, how to manage patients' dysphoria, like I mentioned earlier. There's so many things to keep in mind, and we want to help you through that process. So please reach out to us. My email address is max@oneiowa.org, and I'm happy to help you with that. The other thing that I recommend doing is getting connected to other amazing resources, continuing to read and listen to the stories of LGBTQ people. That helps humanize LGBTQ voices so that you know what your patients might be experiencing. You can also get in touch with organizations like WPATH, which are really good healthcare information resources. There are a lot of really, really great things that you can connect with that can help you continue to learn, because there is no amount of information we could get through in a short video like this that could give you all the information. So please reach out in that specific way. But the other thing that I highly recommend doing is really stuff that's very, very basic, right? So, I mentioned that this is included in part of our training, but I'll give you a sneak peek anyway. I highly recommend you update your intake process. How are you going to be inclusive to trans and non-binary individuals if you don't know what their pronouns are? How are you going to be inclusive to them if you don't use their correct name, right? So I highly, highly recommend that you update your intake process. Again, this is something that we can help you with, but then also making sure that every person in your organization knows how to use pronouns, knows how to ask about pronouns, knows why it's so important to use someone's correct name as opposed to their legal name, for example. So there's a lot of things about the intake process that you can update. And I can't say it enough that intake is actually really, really powerful. It sets the whole tone for the experience that patient or client is going to have in your organization, in your clinic, in your practice. So just keep that in mind. It's a very, very powerful step that you can take. The next thing that I highly recommend doing is using anatomically correct language when referring to folks about speaking. So you might have heard us say breast/chest or breast and chest cancer. And we do that for a couple of different reasons. The first is that breast cancer is something a lot of people are familiar talking about, but if you're working with a trans or non-binary patient that has chest tissue but doesn't feel comfortable calling it breast tissue because it feels dysphoric, like I kind of mentioned earlier, saying breast and chest cancer it means the same thing, right? But it's more inclusive language. It brings in people that don't identify as like having breast tissue necessarily, because the term breast is not a word that feels inclusive or affirming to them, right? So it's learning about those different ways to talk to your patients that feel inclusive to them. But also, if you are talking to a client about cancer screenings like we are today, and you say something like women's cancer screenings, right, or women's health cancer screenings and things like that, what you're doing is you're excluding a lot of people that have chest and breast tissue that don't identify as women, for example. So I always recommend saying the name of the body part you're talking about, right? If you're talking about prostate cancer, say prostate cancer. If you're talking about breast and chest cancer, say breast and chest cancer, right? It's really important to be really specific with what you're talking about, and that way you're not excluding people that you want to reach and people that you want to make sure get screened. And then finally, if you're working with a trans or non-binary patient, keep in mind that these screenings can be just extremely uncomfortable and can cause severe dysphoria for that person, which is often why people don't get those screenings, right? So if they're coming to you, if they're getting screened, if they're kind of taking those steps, that's great. Just recognize that that can be really, really difficult and painful. I mean, a lot of people don't enjoy cancer screenings that aren't trans or non-binary, right? It's not always the most like comfortable or pleasant thing, but it's extra uncomfortable for folks that are trans or non-binary, or it often can be, right? So some ways to help manage dysphoria includes like asking clients what feels most comfortable for them when it comes to language, right? So how do you want me to refer to your breast or chest tissue? Like what feels best to you? What feels most comfortable? You can also take a lot of breaks. There's no reason to rush through the screening. Slowing down and allowing that patient to advocate for themselves is going to be really, really so incredibly powerful. And then always checking in. How is this feeling? How is this going? What's happening for you? How can I make you feel most comfortable? Those are just a couple of things. But like I said, there's a lot of different things to think about. And we are really, really excited at One Iowa to be helpful and be a liaison in that process, because there's a lot to do if you want to be LGBTQ inclusive, but it's absolutely necessary and vital work to be doing as well. So I know that we've given you all a lot of information today. I know Ashley is just like a wealth of knowledge. Every time I talk to Ashley, I learn something new. So thank you so much for being here, Ashley. Please feel free to, like we've mentioned already a couple of times, reach out to us, visit www.oneiowa.org. You can also reach out to me at max@oneiowa.org. I'm also happy to be a resource for you if you have any questions about what you heard here, if you want to get more connected to the Care for Yourself program, anything like that, please feel free to reach out. We really want to make sure that folks are getting screened and that they empower other people to get screened as well. And so we are excited and ready and waiting to help you train your staff, to help you get yourself screened, or to learn more about the LGBTQ community as a whole. So thank you so much for joining us today. Thank you, Ashley, for being part of this. It's such a joy to have you. Any other things you want to add?
No, I just want to reiterate how important it is to get screened. Don't let these things stand in your way. You've got amazing people like Max and organizations like One Iowa and the Care for Yourself program. We want to be there. We want to make sure you're healthy.
Yeah, use your resources. We're here. So thank you so much for being here today, Ashley, and thank you all for watching. We'll see you soon.
Thanks.
Bye.